The morning of February 12th, 2012 started off pretty normally in my busy medical office in Denver with phones ringing, patient consultations, pretty much business as usual. And I was with a patient when my office manager, Joyce, knocked on my door. That was unusual. Joyce never knocked on my door when I was with a patient. "There's a call for you," she said. "You handle it," I said, a little irritated. "No, this is a call you need to take," she said. That call would change my life and the lives of my patients from then on. The woman on the phone was named Paige, and she sounded desperate. "Dr. Shackelford," she said, "would you please see my 5-year-old daughter, Charlotte?" And my first thought was, no, I don't work with children. And then Paige told me that Charlotte had been having seizures since she was 6 months old, and she had been diagnosed with a rare genetic condition called Dravet syndrome. None of the medicines that had been prescribed for Charlotte had worked, not one of 17 different prescription drugs, and now they wanted to try a horse tranquilizer from Europe. And then Paige said something that really stunned me. She said she had been reading that medical marijuana might be able to stop seizures. And she said, "Dr. Shackelford, will you please recommend some so that we can try it for Charlotte?" And I was dumbfounded. How could I possibly rationalize recommending that a child use marijuana for any purpose? And I was concerned that if I did it, it might endanger my medical license. But then Paige told me that Charlotte had had 2 cardiac arrests. 2. At the age of 5. And it made me think of my daughter, Vanessa, who was swimming in the ocean and ice skating and eagerly looking forward to starting school when she was Charlotte's age. And Charlotte had never experienced any of those things. And she might never experience them because 73% of children with Dravet syndrome who have uncontrolled seizures die before their 10th birthday. And when I finished medical school, I pledged to use all of my skills and all of my training to sustain life, to care for the patients I was privileged to take care of to the best of my ability, to use all that training to cure when possible, but to comfort always. And so I knew that I had to see Charlotte. Now, I wouldn't necessarily promise to recommend that she use marijuana, but I would see her. And a few days later, Paige and Charlotte came to my office, and in the 2 hours that Charlotte was there, she had 5 seizures. 1 in the parking lot, 2 in the waiting room, and 2 while I was examining her. Now imagine your child having seizures like this. Again, 300 a week, 3 an hour, every hour of every day for 5 years. Now, I had heard pretty much the same thing that Paige had, that there was a compound in the marijuana plant called CBD, or cannabidiol, that might be able to control seizures. There was one study on it published in 1980, and I just happened to have read that. So CBD is remarkable. Unlike THC, it doesn't get you high. And I did not want for Charlotte to get high. I also didn't want for her to smoke marijuana. In fact, I don't want anybody to smoke marijuana because oral dosing is much more effective. And so I filled out the necessary paperwork so that Paige could go down to the dispensary and buy all of the high CBD, low THC cannabis in Denver, 1.5 ounces for $800. And Paige gave it to an herbalist friend of hers in Colorado Springs who extracted it into an oil, and then Paige, very nervously, put several drops of it in Charlotte's mouth. And I was on pins and needles after this, waiting to hear what had happened. Had it worked, or had it been a dismal failure? Had the whole thing maybe been a huge mistake? It was like waiting for the astronauts to land on the moon, if you remember that. And then finally, when Paige did call me, she said, "Dr. Shackelford, Charlotte has not had one single seizure for an entire week. Not one. It's like a miracle." And Paige was right. It was a miracle for Charlotte. But I had known, long before I met Charlotte, that medical cannabis could work wonders. I knew it actually 3 years before because a patient of mine named Joan in an occupational medicine practice where I was working at the time had asked me to make it possible for her to use marijuana for pain. Joan was a remarkable patient, but she had been injured in a work accident and was taking more than 100 Percocet tablets a month. And the pain was still so bad that she couldn't do normal household chores, even cook for her family. And she was severely constipated and was worried about being addicted. But she had read that marijuana might be helpful for chronic pain, and she begged me to make it possible for her to do so. So very reluctantly, I filled out that paperwork so Joan could try it. And Joan went out and got the medical cannabis. Now, I say reluctantly because I knew nothing about it. I didn't know anything really about how to recommend cannabis, and there was no medical research on it. I couldn't find any articles on it in any of the medical journals that I was reading. You see, I'm a classically trained, very conservative physician. I graduated from the University of Heidelberg School of Medicine, where I did research as a medical student, and then I did 7 years of postgraduate training at the Harvard Medical School, where I was also a research fellow. I don't usually recommend treatments that I don't understand, and I want to know exactly how the drugs work. But I didn't have access to any of that scientific data that I normally relied on when it came to medical marijuana. What I did have was a desperate patient whose pain medicines weren't working very well. And to my surprise, and I have to say to my great relief, it worked extremely well for Joan. Joan was able to reduce the number of Percocets she was taking from 100 a month to 50, then to 20, and then she could stop taking it altogether. It was really pretty remarkable. Now, today, just 6 years after I first met Charlotte, there are lots more articles in the scientific literature on the medical uses of cannabis and on the more than 100 different compounds found in the marijuana plant that are remarkable for their medical applicability. Let me give you an example. Researchers in California have found that cannabis is a particularly good treatment for pain, and it is in fact the THC that is so powerful. Researchers in Israel learned that nearly half of the patients with Crohn's disease who use medical cannabis no longer have any symptoms of the disease at all. And there are tantalizing early indications from research on the plant that some of the compounds found in the marijuana plant may someday be used to treat cancer. Now, a lot more research is necessary, and marijuana is not a panacea or a cure-all. But the medical community is now beginning to recognize that cannabis may play an important role in taking care of patients for whom conventional therapies aren't working very well. And that is something that most of the 20,000 patients I've seen over the last 9 years can attest to. I had really no idea where that phone call would lead me 6 years ago when Paige called, but I can say from a great deal of experience that miracles are pretty commonplace among patients for whom nothing else has worked. Nothing but medical cannabis. This is not about pot. This is about patience. Now, you may be wondering about Charlotte and what happened. This is Charlotte about a year after she first started using medical cannabis. What Charlotte is saying here is ballerina, ballerina. And you can see her dancing. And she's still doing very, very well. Now, next time you or someone you love is suffering from pain that's not responding to conventional treatments or has another medical condition that might benefit from the use of cannabis, think about medical cannabis, think about the thousands of patients who have benefited from it, and think about Charlotte, that ballerina. It changed her life, and it just might change yours. Thank you.